Hello there. Please do come on in. Make yourself comfortable. My name is Bryoni. What's your name? Oh, it's so lovely to meet you. Can you tell me a little bit about what's been going on or what brings you in today? Okay. No problem. So just a general check, just to make sure everything's okay. Alright, no worries at all. So, regarding your face, do you have any sort of sensitive spots, sensitive areas that I need to be aware of? Or any allergies or anything like that? Okay, no worries. I won't be using anything harsh on your skin, so you don't need to worry about that. Okay, I am just going to pop on some gloves. Do just make yourself comfortable, okay? Okay, so to begin with, I'm just going to have a look at your face and your skin. I just want to make sure everything's okay. Alright, just visually. I just want to check. Okay. Alright. Are you happy for me just to have a little feel around of your face? Okay. If you have any pain or discomfort, do let me know. Okay. Okay. Okay, how's that? Any pain or discomfort? Any sensitive spots? Okay, it generally feels fine, looks fine. You have a couple of dry patches, but I don't think there's anything to be concerned about. Most of us have some dry patches, dry skin. It's absolutely fine. You can just get sort of a moisturizer to just calm that down. There's no eczema or anything like that, and there's nothing that I'm concerned about. What I am going to do now, I'm just going to use just one finger and I'm just going to rub, okay? You just tell me if it's sensitive, if it hurts, anything at all, okay? not going to touch, just prod, okay? I'm going to put a bit more pressure on, so you just tell me how that generally feels, okay? Shouldn't hurt though, alright? How's that? Good. I'm now just going to put some pain, just some pressure here. You might feel the pain, but I am going to push, okay? I want to try and stimulate, just to see what it feels like, okay? So I'm just going to push. I am quite pushing there. How does it feel? Does it make you feel dizzy? Headache? Migraine? Does it make you feel nauseous or sick? Ready? So I'm just going to push. I'm just going to try and pop some pain. How's that? No pain? No, that's a good thing. Wonderful. Okay, no, that's great. Okay, what I'm going to do, I'm just going to pop on some of this oil. Okay. Now, you'll be absolutely fine for your skin. I just want to try and put that just on a couple of those dry spots. And then I'm just going to be using a couple of tools just to feel around. It just makes it not itch or hurt as much when I'm doing that, okay? So yeah, I'm just going to pop a few drops on. Okay, I'm just going to... And then I'm just going to pop some on my hands. Lovely. Just so that I can rub that into your face. Just going to rub. Get a little bit of a massage as well. Perfect. Okay, I'm just going to use a little brush. It's very gentle, but do just tell me how it feels, okay? Mainly if it hurts, if it itches, that kind of thing. I just want to have a little look at some different spots, okay? Ready? Perfect. Now I am going to use a couple of these tools. First one I'm going to use is this pink one, okay? Again, it's just going to tickle a Okay, so just let me know how that feels. It might itch. How's that one? Okay. And now this one, I'm just going to sort of sweep it. So you just let me know how that feels. It's very gentle. I can brush. Okay, good. And now I'm just going to sort of scrape a little bit, okay? So I'm just gonna scrape it, 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 scrape it How's that for you? Good. Okay. Next, I'm just going to use a light, okay? I just want to have a look at some of your moles and freckles that you have. I just want to make sure they're okay and that I'm not concerned. Generally, if your face looks fine, it's responding well. Okay, so I just have to check this. So you can close your eyes if you like, or just look straight ahead of me, but do not look at the light, okay? It's going to be bright. So I'm just going to look at your skin, okay? I'm going to use a brighter light. Again, don't look at it. Just want to look in a bit more detail. Yeah, that's okay. They look fine. Not concerned at all. Okay. Yeah, your face is wasn't too bright for you. Okay, well, what I'm just going to do now is want to check your facial nerve, okay? So just copy me, alright? I want you just to do this with your hands and just really move your face. Just move your cheeks like this, just move everything. That's it, copy me. Can I try? Yeah, that's all fine. Now what I want you to do, I want you just to move your head from side to side and up and down. I'm just going to feel that while you do that. Perfect. Can you do a really big smile for me? Lift your eyebrows. Okay. Do a frown. Good. Can you puff your cheeks? Good. Can you bring them in? Good. Can you wink? Wink, wink, wink. Perfect. Alright. Well, your face looks absolutely fine. Your facial nerves are fine. Your skin is generally okay. A little bit of some dry patches, but the oils really helped. Just moisturize that when you can. Okay, your moles and freckles are absolutely fine. There's nothing to be concerned about. Alright. Well, everything looks good. I'm happy. Please do come back to see me if anything changes, okay? Alright, well, do take care. Bye-bye. Oh, hello there. My name is Bryoni. Now I just come to check your observations, your vital signs. Is that okay? So it would just be your blood pressure, your oxygen saturation level, your heart rate, your respiratory rate, your temperature, and I will also just have a little listen just of your chest. Is that alright? Lovely. Okay. Well, do just make yourself comfortable. Okay. Now, I'm just going to check your temperature. So I'm just going to use this. And it's just going to go just here on your forehead. Okay. Alright, you ready? Perfect. It's 36.7. The temperature is fine. Now I've got here, this is an oximeter. You just pop your finger in there and it just tells me your oxygen saturation level and your heart rate. Okay, so just pop your finger in there for me. That's it. Pop it in and just hold it. Just hold your hand out flat. Lovely. And now just take a nice deep breath in and out. Take a nice deep breath in and out. Oh wow, it's 100%. Well done. Now it also says that your heart rate is about 86. will check that manually, don't worry. I'm just going to take that one off. So I'm just going to check your heart rate. I'm just going to feel for your pulse, okay? Just pass me your wrist. That's it. I'm just going to check it for a minute, okay? Okay, that's interesting. I actually got 86 as well. That's so strange. So it means it's working, but your pulse is regular. I didn't feel anything sort of irregular with that. I didn't feel any sort of ectopics or anything. Okay, alright. So I'm now just going to check your blood pressure. Okay, have you had this taken before? Right, okay, so the cuff goes on your arm. Okay, I will feel for your pulse. Okay, I will pump the cuff up until I can no longer feel your pulse. Okay, and then I will deflate it. Okay, I will then inflate the cuff again so I know how much to do it, and then I will listen for when the sound comes in for your blood pressure, and then when it goes up, that'll be your bottom number. Okay? Alright. So, I'm just going to, first of all, I just want to feel up here just for your artery. Is that okay? Just gonna push. It's usually under that muscle. Okay, so I'm just going to put this on. If you can, just slide your arm in there for me. That's it. Put that right up. I'm just going to tighten it. Lovely. Now just relax your arm there, okay? What I'm going to do, sorry, it's a bit fiddly. I've got to hold these two, okay? Just gonna make sure this is closed. Lovely. Okay. So I'm just going to feel your wrist, and I'm just gonna pump this up, okay? Till I can't feel it anymore. About there. Oh, sorry, it's a bit tight. I'm just going to deflate that. That should be deflating now. Lovely. Okay. Alright. What I'm going to do now, I will pump the cuff up, but this time I'm just going to have a little listen and check your blood pressure. I'm just going to pop this just under there, just under the cuff. Lovely. Okay. And I'm just going to pump it up, alright? Lovely. I'm just going gonna listen. Okay. There it is. Okay. Lovely. Your blood pressure is 126/77. Okay. I'm just going to take this one off you. So just slide your arm out for me. Just take that little bit of air out. Lovely. Okay. Now what I'm going to do, I'm just going to assess your breathing. So I want you just to breathe nice, natural, and normal. Okay. I'm just going to see what your respiratory rate is, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Good. Your respiratory rate is 16. That's absolutely fine. Now just breathe normally as you were, okay? I'm just going to have a little listen just to your chest. Okay. Lovely. And here. Good. And now here. Okay, take a deep breath in. And out. Good. Breathe normally. Okay, deep breath in. And out. Wonderful. Well, your observations are absolutely fine. You're doing really, really well. Okay. Now I hope you continue to feel well. But if you do have any problems, please do come back to see me. Okay? Alright. Well, do take care. And you know where I am if you need me. Bye-bye. Oh, hello there. How are you? I understand you've been getting some issues with your ears. Is that correct? Hello there. My name's Bryoni. Do please make yourself comfortable. Are you here for me to check your eyes? Good. Can you tell me a little bit about what's been going on? What you've been experiencing? Right. Okay. Alright. So have you been experiencing any blurred vision, double vision, or multiple vision? Okay, any redness from your eyes? Any watering? Okay. Any difference you can see sort of with your vision? Okay, alright. Well, don't worry. Seems like it's just going to be a little checkup. Okay, that's good. Alright, so I'm just going to pop some gloves on. I've got my pink gloves today. Do just get comfortable. Okay. Alright, just look straight at me. I'm just going to first of all just observe your eyes, okay? That's it. Just look straight at me. Okay. Alright, that looks fine. Now, is it okay if I just touch around your eyes? Do let me know if there's any pain or discomfort, okay? Okay. Okay, I feel okay. Alright, could you just stay straight looking at me with your eyes only? Just look side to side. That's it, look from side to side, to the side, to the side, side to side. Good, and now just look up and down, up and down, up and down, up and down, up and down. Okay, side, 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 up and down, up and down, up and down. Very good. Just blink, blink. Okay. Could you now just look it? Look it. 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 Okay, good. Look it. 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 Good. Look at my finger. Keep following my finger. Follow my finger. Keep following my finger. Very good. Follow my finger. Follow my finger. Follow my finger. Follow my finger. Perfect. Okay. Look at the switch. Look at my mouth. Look at the glove box. Look at my hair. Look over here. Look at the switch. Look over here. Look at my mouth. Look at the light. Look at my hair. Look at the switch. Look at my eye. Look at my mouth. Look at the switch. Look at my hair. Look at the light. Look at the glove box. Look up here. Look here. Look at the glove box. Look at the light. Look at the switch. Look at my mouth. Look at my eye. Look over here. Look over here. Good. Tell me when you can see my fingers, okay? Good. 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 Wonderful. Okay, we're going to do the opposite. Tell me when you can't see them, okay? Good. 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 Wonderful. How many fingers do you see? How many? 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 Very good. You can blink. Blink. Okay. I'm going to use a light. Please do not look at the light. You can look just straight ahead of me. Okay? Now look at my hand. Just gonna look at your eye. Okay. Is that bright? Okay. How about this one? How's that? Bright? This one? Okay. Is that okay? Alright. Look at my hand. Do not look at the light. Okay, look at the side. Do not look at the light. Okay. Could you just look up for me? Okay, look down. Look left. And look right. Okay, look up. Look down. Look left. And look right. Okay, I'm just gonna look. This side. Just gonna. Okay. Just gonna look at your eyes. Okay. Alright, now just look at the light. Could you just follow the light for me? Follow the light. Follow the light. just blink. Blink. I'm gonna put the brighter one on. If you can, just look at the light. Okay. Look at the light. Look at the light. Good. Look at the light. Is that really bright for you? Yeah, okay. Okay, just one more. Look at the light. Very good. Perfect. I've got some eye charts here. First one is numbers. Could you tell me what this is? What number? Good. This one. Perfect. What about this one? Okay. Good, good, good. This one. Good, good, good. Can you do this one? Oh, perfect. Well done. Okay, now we've got this eye chart. Okay. What's this one? Good. This one. This one. This one. This one. This one. This one. Okay, can you do the last one? This one. Perfect. Wow, you've got very good vision. Okay. What color is this? Good. And what color is this one? Perfect. Alright. Next up, I'm just going to check for color blindness. So just tell me what you can see in here. What number? 12? 1, 2. Good. What number can you see here? 8. Now they do get harder. Okay. What number can you see in here? Good. What about this one? Good. Let's do 2 more. What about this one? Can you see in here? Perfect. And last one. Let's do this one. It's tricky. Yeah, it's not actually a number. It's designed to trick you. It's just a button. Yeah, you can see the green. Perfect. Wow, you've done extremely well today. Just a quick little eye check, but you did absolutely perfectly well. You had nothing to worry about. Everything is absolutely fine. Alright, well, do take care. And I'll see you soon. Bye-bye.